Welcome to this video where we will talk you through your child's cardiac catheter admission. Prior to a catheter admission, there are a few things to be aware of. The cardiac nurse specialist will have run through your child's medication and advised you if any need to stop and advised on nil by mouth times. Please ensure that your child has had a bath or shower on the morning of their procedure. For older children who are undergoing a cardiac catheter procedure, we ask that any pubic hair in their groin area is shaved. Admission. Please aim to arrive on Dolphin Ward, Level 6 of the Children's Hospital at the time stipulated in your admissions letter. You will meet with the interventionist who will run through the procedure with you and obtain consent. If you would like this discussion to be held away from your child's bed space, please let someone know. You will also meet with the anaesthetist who will talk you through what to expect in the anaesthetic room. For females over the age of 12 who have started their periods, it is a trust policy to perform a routine pregnancy test on admission to the ward. Overnight stay. The cardiac nurse specialist will advise you if it is possible that your child may be discharged home on the same day. However, we do advise all families to bring an overnight bag just in case. 2 parents, carers, are allowed on the ward, and there will be a pull-down bed next to your child's bed for one parent to stay overnight. The procedure. Just before the procedure, the patient will be asked to change into a hospital gown. If they weigh 40 kilograms or over, they will also be asked to put on compression TED stockings. One parent or carer will be able to accompany their child to the anaesthetic room. Once the procedure has finished, they will be able to accompany the ward nurse to bring their child back to the ward. Recovery. Upon return to the ward, your child will be attached to the bedside monitoring equipment. Observations will be undertaken. This will include taking their temperature, checking the groin site, checking for a pedal foot pulse, and checking their feet feel warm. Gradually, these observations will be reduced. We would not expect them to be in pain. However, it is not uncommon for them to feel some discomfort and bruising in the groin area. They will have a cannula in their hand, which can be used to administer anti-sickness medication and pain relief as necessary. The patient will be required to lie still for 4 hours after a cardiac catheter procedure to reduce the risks of bleeding. After 4 hours, they will be able to start mobilising. Once they have been mobilising, they will be able to remove their compression stockings if they have had to wear them. The patient will be able to eat and drink upon their return to the ward. Food will be provided for our patients, but you are welcome to bring snacks. Finally, the interventionist will come and speak with you after the procedure to let you know how it's gone and plans for follow-up. For patients who have undergone a pacemaker procedure, the physiology team will come and speak with you too. Discharge and follow-up. Upon discharge, you will be given a discharge letter with details of the admission, follow-up information, and advice regarding wound care. We recommend no baths or showers for 48 hours post-catheter procedure to reduce the risk of infection. Check your child's wound and inform us if you have any concerns such as spikes of temperature, their wound looks infected, becomes red, hot to touch, or starts oozing. We will aim to call you within 72 working hours to see how it's progressing, but if you have any queries or concerns, please contact the cardiac nurse specialist team on 0117 342 8286 or out of hours Dolphin Ward on 0117 342 8332 or on our email cardiacnurses@uhbw.nhs.uk. Thank you for watching this video.